This coffee just tastes like toothpaste. Hey guys, it is Jason, and I was going to be doing a ranty topic today because I have like two quite major rants that I want to talk about, obviously regarding trans things. However, having sort of like been really pissed off for the past like few hours, I'm not going to bother. I'm going to talk about something happy because, you know, seriously, fuck these people. So yes, topical as promised, but something positive, and also linked to what is going to be happening to me next week, as in I'm going to be going to Charing Cross for my first appointment. But in the meantime, this is a video for those of you who either sort of are still wondering about your identity, or you have come out as trans and you want to medically transition. Like, what do you do? What are the first steps? How the hell do you get to Charing Cross? Because it's kind of like Fort Knox in the medical world, or like whichever gender clinic you are closest to. Now, just as a disclaimer, as you can probably tell, I'm going to be talking about the UK part. I'm going to be touching a little bit on the US and Canadian system, although it is different per state, so I hear, so I don't really know very much about it. I'm also going to be talking pretty much from an FtM point of view, because I am FtM. There will be differences for yourself if you are MTF, different things that you want to look for. However, I will be talking a little bit about it potentially. If I can think of anything that crops up beforehand, I'll try and think of something. Also, I want to just say, this may be a little bit controversial, but I want to make you aware, depending on what you want to do in order to transition medically, the NHS route might not be the best for you. Now, I'm not trying to say that, going private is amazing, because, there are pros and cons for each of them, and there are plenty of videos out there about, like, pros and cons for NHS versus private. But certainly in terms of your sort of medical transition path, as it were, or tier or whatever, the NHS's way of going about things is quite strict, and they do things in a certain order. Now, for me, this works perfectly because it just so happens to fit with what I want and what I need. However, this isn't for everybody. Not every trans person wants to medically transition completely. Some don't want to actually do it at all. Now, it's still fine to go down the route of the NHS to begin with and say, okay, I don't actually want to get hormones, I don't want this, but I do want this and I do want this. So that's also good to bear in mind. But if you're thinking, for example, more like you want surgery but you don't want hormones, that is very difficult through the NHS. However, I believe there are ways to go about it privately. It's not like completely impossible, I just don't know that much about it. So it's just something to bear in mind. Do your research about both. And of course, I have to mention that if you don't know nothing about sort of the procedures as well with the NHS, it is a hell of a long wait for anything to happen. But as someone called CJ rightly said, you're either buying your transition with money or you're buying it with time. Just to bear in mind, even if you do go private, sometimes the waiting times are also quite big. Basically, what I'm trying to say is, before the medical transition stuff really gets going, so you actually go to a gender clinic or you go and see somebody privately and you actually talk about stuff, there are these bits beforehand that you need to sort out, and really you should be doing these as soon as possible, as soon as you feel, okay to do it. The reason being is, some people might say to you, oh, well, you might change your mind, and you need to think about it first, and you need to kind of get used to being the new you, as it were. And that's all very well, and that yes, there are an extremely small amount of people who decide to detransition or decide that this is no longer for them. However, especially if you're going down the NHS route like me, you have so much time to sort of think about these things and also we think about these things every day anyway because it's such a big deal, that if you wait in order to sort of firmly decide before going down, getting a referral and so on, you will have wasted a lot of time. I mean, take it from me, I went straight to do all the bits before, which I'm going to explain, and since then I've had to wait all the way from last October to now in order for anything to happen. So that is already almost a year of waiting, and even after the first appointment, I can still, think about stuff and think, oh, do I actually want this? It's about a year and a half to 2 years before anything really happens. And that is after you do all these bits with the referral at GP. So, let me explain them to you, rather than just call them bits and blah blah blah. So, what you need to do first in order to get anywhere to a gender clinic is you have to get a referral from your GP. Now, obviously, this can have its own problems, depending on the GP that you were with. Sometimes, like mine was at the time, they can be very open, they can be very accommodating. Even if they don't fully understand, they will still be willing to learn. However, there are some people who just do not want to do that, based on various reasons, which is really shitty, but something to warn you about. For example, there was Alex who had this problem with his GP. The GP just didn't want to deal with it, put her hands up and was like, no, not doing that at all. And this is in the UK, it's a bit insane, really. This can also happen a lot in America, obviously not GPs, but psychologists can be a bit of a problem, because in the US and Canada you have to usually go to therapy and actually see a psychologist. And again, there are problems where they just will not treat you. So if you do run into any problems like that, definitely move GPs, maybe even move surgeries altogether, or surgeons altogether, in order to, find someone better. I believe that there is a small amount of people who are recorded as being officially, open with trans people. I'll try and find a link and put it either as a card or as a description or something. So if you happen to live near one of them, that's amazing. If you're still getting grief, I suggest that you take it further and actually do an official complaint. It has worked before, not for me personally, but I know of people who have done this and complained about their GP refusing them treatment. And what happened was, essentially, they had to provide it because, come on, they're a doctor. And they're not even providing treatment at this point, they're just giving you a referral. Psychiatrists, do you have to see them? Do you not? Blah, blah, blah. The answer is no. In the UK, the sort of whole concept of dysphoria is no longer actually regarded as a mental illness. So no, you do not need to see a psychiatrist. You obviously can if you want to, maybe if you have lots of sort of underlying mental illnesses or mental issues that you want to sort of speak to people about, that's absolutely fine. However, I have done my transition without any kind of psychiatrist intervention, which is something that you used to have to do. I also know of a few people who have gone down the psychiatrist route, realised they didn't actually need to do it, and they've wasted like 2 years worth of time. So, if someone says to you, oh, you need to see a psychiatrist, you actually don't. So again, something to be aware of. So what actually happens, what do you say, what happens, and how many appointments do you have, and so on with your GP. So what happens is, when you go there, you obviously have to explain things. One tip I would suggest with this, try and keep it as simple as possible, which sounds really ridiculous, and, I'm not trying to sort of simplify, our condition, because it's really not simple. But just to make sure that the doctor understands at this initial stage, they will not necessarily want to hear about every single little thought that you've had. That's something that Charing Cross, or say, your own clinic, will look at. What the GP really wants to know is, are you transitioning to become this gender, or are you non-binary? And you would like to have a referral to this place in order to, go down the path of medical transition. That's really all they want to know. Notice I did say non-binary, so don't worry about saying to a GP that you are non-binary, because there are gender clinics, especially Charing Cross I've noticed, that do adapt perfectly well to people who are non-binary. You may have to explain more to the GP, I mean, it really does depend on who they are. But I don't think you should hold back or pretend to be transitioning to male or female when actually you're non-binary. You should be as open as possible, but just keep it simple. So another example I have is, certainly with me, of course I identify as male. However, I think, a certain part of me is non-binary, and, I've kind of always thought this, and I was identifying as fully non-binary for like a few years, and I will also link a card to a video which I'm going to be doing about that. However, I didn't mention that because to a doctor, and again, it sounds really ridiculous, it might sound like I am just confused about me. So definitely be really, really assertive. They might ask you things like, well, how did you feel when you came out? Have you had any second thoughts? This, that and the other. One thing as well, when I talked about things like I got a binder and stuff like that, a bit later down the line, she asked me, well, how did I feel about that? And I told her how amazing I felt. So, basically all these sort of pointers that put you in the right direction, sort of checking boxes, as it were, of like invisible boxes that they don't even have anyway. So yeah, the initial appointment will be just sort of explain to the doctor what you want as a person, what you need, and they might do some things like take a general sort of examination of you, like, so for example, height, weight, blood pressure, things like that. They might ask you if you've got any sort of like if you're taking anything medical, or if you've got any pre-medical conditions, that kind of thing, and then that's it. And then what happens is usually the GP will then book you in for some blood tests, because what you do need to do is get your blood tested for several reasons, which I'll go to in a minute. So for me personally, I had to have 2 blood tests. The reason being that they did the first batch and then they kind of turned around and was like, oh, apparently one of them wasn't good or something, so we have to do it again. So I'm like, right, brilliant. But the reason why they take blood tests is mainly because they need to assess that you are healthy enough to go, for example, on testosterone or estrogen, i.e. take hormones. But they're also looking to see sort of general levels of hormone activity in your blood. So one thing that came back with mine, and you do learn quite a lot about yourself in these cases, I apparently have a higher level of testosterone in my blood, sort of free testosterone, than the average person who's assigned male at birth. Assigned female at birth, sorry, I'm so sorry. So the average is about a 5, whereas I'm on about a 6.4 or something, or a 6.2, and there's like a big exclamation mark next to it on the findings, so that's quite interesting. So that is a piece of paper that I have to then take to Charing Cross eventually, but something like that might happen. Another thing that happened with me is because of this sort of revelation of the fact that I had higher testosterone. One thing that the doctor thought, and this is pretty common for the doctor to sort of assess this in this way, they will probably say to you, you need to be tested to see if you have polycystic ovarian syndrome. So what that means is cysts on your ovaries. Now, in terms of that, I'm not going to go into detail about how that went, but then essentially what happened was I had to then go to another appointment at a hospital in a local area and actually get a proper ultrasound scan down there in order to check whether I had cysts on my ovaries. Fortunately, everything came back wonderfully clean, so I do not have cysts on my ovaries. But again, this sort of helps me because it means that I just have free testosterone that is higher levels anyway, so therefore, it needs to be treated, and my body obviously likes testosterone, so don't worry too much if your doctor comes back and say, oh, you might have polycystic ovarian syndrome, or that you might be intersex, or something like that. There are all these sort of things that might come up that you have to check, and they will help you with that. Like they'll give you the right appointment to do and things like that. Then once all the sort of complications, if there are any, have been cleared up, that is when your referral goes off to Charing Cross, or say off to wherever. I'm using Charing Cross because that's mine, but off to wherever it is that's closest to you. And then what happens is you will get some kind of pamphlet come through the post like this. This is my Charing Cross one, how we manage your information, and various other bits. and you also get a letter that says thank you for your referral and blah blah blah. Now again, I'm using Charing Cross. I'm not entirely sure what it is for every single gender clinic, but you have to sign consent forms. This is something Charing Cross have put in place, so they know for sure that you want to do this, as opposed to you think you do, but then you turn it down, because apparently lots of people have been doing this, which is interesting. I'm a bit sceptical about that, to be honest, but you just have to go through all the hurdles. They asked me to complete them in 2 weeks of the date, which I did. I may have left my D-poll out of the letters, so I had to post that separately, but it was like straight after, so it was fine, and they got it. And then that was it, essentially. I had to then change doctors when I moved up to Northampton, and sort of let my previous GP know that I would be moving. But that is pretty much it. Once you start getting letters from your gender identity clinic, that's it. You don't have to worry about seeing your GP anymore, certainly for the time being, until you are administered with, say, hormone replacement therapy. Now, just to talk about sort of what to expect at the gender clinic, because I mentioned about you don't have to, medically transition with hormone replacement therapy and stuff. So other things that they offer there, they do an assessment of you, and it's at least one assessment. For Charing Cross it's 2. They might speak to you about things like speech therapy, especially for trans women. They might also talk to you about, say, for example, social or legal sides of things, which, again, is something that you can get help through them. So for me, and the legal side of things, and this is one of the things I was going to be ranting about, but I'm going to do a separate video, what I'm going to have to do in order to sort of legally transition any further is I'm going to have to go and speak to them and ask for a letter, or actually a couple of letters, come to think of it, in order to get my passport changed, and also down the road the gender recognition certificate, which again I'm going to talk about in a separate video. But yeah, so that's what happens, and then depending on the waiting times, you don't hear about anything after you get that initial letter about the fact that they've got your referral. You might hear from them, maybe from a phone call or something, but usually you don't. I got quite worried at one point, and I actually persistently phoned them until I finally got through, and they said, oh no, don't worry, you're probably going to be seen, in October sometime. What they actually said was they're going to contact me in September, and my actual appointment will be in October, but no, it just so happens that it's in September, so it was actually a little bit like a few weeks earlier than they predicted, which is really good. Yeah, it's a long road, and even just before this first appointment, I've transitioned mentally so much, and socially as well, and also any bits of legal stuff that I have been able to do. All these things you can do, and all these things will either validate you as a trans person, or, you can always, by all means, and this is also the way I thought about it, I thought, well, if there's anything I'm not comfortable with doing in terms of transition, then obviously I can think about it and think, okay, is this really what I want? But so far, nothing for me has actually said that, or has given me these second thoughts, which people seem to be so sort of caught up in. The waits for each gender clinic are different, like I said, but they are always at least something like 6 months nowadays. Certainly with Charing Cross, I know that, say if you put your referral in now compared to me last year, it's even longer than I've had to wait. So I think it's something like 13 to 15, 16 months, something ridiculous like that. For me, it recommended it was about 13 months, and it does say that on the initial letter. So honestly, what I would do with that is just think or expect the worst, because it's going to take a long time, and I can't stress that enough. So with the GP, do those bits first, and then, if there's anything you are not sure of, or anything that you think, oh, I don't actually know if I want to go down this route, you have so much time to turn around to your gender clinic and say, actually, no, I don't want to get an appointment, or actually, no, I don't want to go any further. Even down the road with the assessments, you can actually say to them, I don't want to do this anymore. There is so much waiting time. So, I recommend, especially if you're pretty much sure by now, to just do it. Do these bits. Get them out of the way as soon as possible, like I did. and you know, at least you're sort of there and in the queue, and you are sort of ready then to go on to the next step. So yes, I hope you enjoyed this video. Apologies that the lighting changed, but it is kind of cloudy outside. I'm always apologising for the lighting, but never mind. But yeah, I hope you subscribe down below. I make videos every Wednesday, and I'm also on Facebook and Twitter, so feel free to follow me, like me, blah de blah de blah. And I do awesome stuff on there as well. And also Pair of Geeks. Don't forget to subscribe to Pair of Geeks. Bear in mind, for those of you who have just joined me after a while and you think, where the hell are all the roleplay videos? They're on Pair of Geeks. So go to Pair of Geeks if you're interested in RPGs, tabletop games, nerdy stuff, which I do with my amazing and wonderful fiance. And I will see you guys in the next video, where I'll be talking about my experience at Charing Cross, and hopefully it will have all gone smoothly. So I will see you guys then. Bye bye.